Good afternoon, everyone. It's Governor Michelle Lujan Grisham, and we're going to follow the same format for these news briefings. This is a homemade mask that was sent to me by Jilly Oyenke. I mentioned that on Wednesday, a member of IATSE, and I still thank her. It's a very thick mask, which is fantastic, but it is very difficult to hear. So for the press conference, and I'm distanced from two secretaries who are also here today to give updates and answer questions. Someone that I know everyone's pretty familiar with now, Dr. David Scrace from the Human Services Department, and Secretary Bill McCamley from Workforce Solutions. And we want to talk a little bit about economic recovery and economic support that we have available and want to make more available to as many New Mexicans as we can. But we're going to start in the same fashion that we always do. I might have a slide come up. We're going to talk about the number of cases. So we're at 2,521 cases, 153 new cases today. We have 152 hospitalizations and 38 on ventilators. Now, I want to talk to folks about that. That's a fairly significant double-digit increase in hospitalizations, largely still the northwest corner of the state, and that's that's obvious data for folks. The number of people who are infected, who are also exhibiting symptoms, who are sick, who require hospital care. We know that this virus, if you're going to have symptoms and if you're going to need medical care, that there is a high degree of likelihood that it's critical care, that it's going to require ventilators, and we know that folks are at great risk. And so this is a very important number. We watch that number carefully. It's both about healthcare capacity, where we have that capacity, the number of ventilators available to make sure that we have them. And of course, the way that we address that, by and large, is by continuing to flatten that curve. And in areas where we have, increased transmission community rates, and we've got to do a better job looking at community containment strategies. And we work with everyone in those cities and those counties. We took out the number of deaths, and you don't need to put that back on, but we have, unfortunately, 6 new ones today for a total of 84. And again, this is harsh. There's no governor, no family member, no individual anywhere in the world that wants to report on this. All 6 today, we mourn with these families. Everyone, our condolences. It's incredibly painful. These are all folks over 60 and all other healthcare complications. I want to also point out that not everyone that we've lost in New Mexico has been in that older high-risk cohort. There have been 30-year-olds and over, and so no one is immune from the ravages of this infection. I want to make that very clear, and I'll tell you why I want to make that clear. 2 more quick things. Leave that slide up. What I'm looking for in the medical data, and you should be looking for that too. I get up every morning, and as we get briefings, what I want to know is that there are 0 new infections. All right, that's what everyone is looking for. Do I expect 0 infections every day? I don't. The virus lives among us. We'll have to manage it. There will always be cases. So we look then, the percentage of cases tied to the number of tests that we made, and we just use that as another data point so that we can kind of gauge, are we seeing more infection rates? Are we finding more individuals who are infected? Do we have more people who are exhibiting symptoms? All of that information is incredibly valuable so that we know what we're doing. So just to give you an example about 153, for those of you, myself included, that number seems way too high. It's about 3% of the number of tests that we ran. So we're now getting to that 5,000 number. We've been promising New Mexicans that we will sample individuals, we'll have testing capacity, we'll keep building that. So that's good news. 3% is lower than the average nationally, and it's significantly lower than just a week ago when we ran a little over 1,000 tests. We had 10% come back positive. Is that data set by itself all good? No. because it depends on where the samples come from, what kinds of individuals, are they essential workers, are they in high-risk areas? All those kinds of factors are also relevant and valuable as we make decisions. But still, and we've got Dr. Grace to make sure that if we have questions about that, we are in fact flattening that curve. We're doing the right work. And before I go on to the next thing, we really want to focus on economic issues. And so I want to talk a little bit about our Economic Recovery Council, and I'll go quick because I know we want to get to some of the unemployment information and questions. But something I really want to say, I'm going to repeat it, so that if people just show up at the end because you're working or doing homeschooling for your children or family, or you're a child care worker, any number, a healthcare worker, and can't tune in for the entire update, we are serious about the impact of, and I'm going to show you a slide later, so we're not going to bring it up right now. We are gauging every single day in the same way that we look at the cases in New Mexico. I look every single day at what the economic impact is. How many people are filing for unemployment insurance? How many businesses are contacting us about their issues? How many folks are getting any kind of economic relief? How many bankruptcies? We look at all of that information, and we can see as a state what kind of economic activity we have at any one given time. And so we're looking at that data all of the time, and it is clear that we have real issues that must be addressed. And if we don't deal with our state's economic health, what it translates to is individuals have insufficient resources to support their families. All right, and that is untenable, cannot have it go on much longer. And we are clear, everyone is clear. There's no governor in the country that wants a poor economy or doesn't worry, including me, about what happens at the kitchen table with families who are struggling. We're clear about that. So we want to talk about that today so you can see that we're doing, I think, the right work, leaning in and trying to get back to some kind of normalcy. But I do have a little caveat and something that I'm a bit disappointed by. And I don't think folks really heard the message on Wednesday. We are flattening the curve. That's good for healthcare workers. That means we're saving lives. That's all the work that we should do. But that hope, that looking at ways to open up the economy, to have more businesses available to all of us as New Mexicans, more opportunities for us to get outside, to take a hike, to go fishing, all those things that people are missing in the spring, was not intended to be a message for businesses, and some did around the state. They just opened up. That message of mine, that there's hope out there, that we can begin to ease some of those restrictions, that message meant we can open our doors, and in fact, they had customers. So people sent photos, it was on social media, there were some folks who had questions about whether that was a safe practice. It's not. Our orders are still in effect until April 30th, where we are very clear about which businesses are essential and open and which ones are not. We're very clear about what guidance we've provided, including metering, which means how many people can go to an essential business at once. And we were also, I think, very clear that I'm going to extend those public health orders through May 15th. I haven't done that yet, because we are also hoping that we might be able to ease some of those restrictions. I can tell you this, that if people are driving around and they're going to businesses that are not supposed to be open, they're going to put us in a position not to be able to reopen the economy in some productive, planned, safe way. So be hopeful, be optimistic, be clear that we care about the economy. For businesses that opened up, I'm sure it was just a mistake. If you've got questions, call us. The orders are still in effect. And to New Mexicans, please stay home so that we can recover in every facet. That's what's important to everyone. All right, enough of that lecture. You're likely to get it again at the end. I apologize. It's really an important message. We have to do both. Be safe and look at economic recovery. So I know many of you have heard, and I'm grateful for that. And let's thank Congress, including our own congressional delegation, 3 members in the House of Representatives, 2 senators. So in the first stimulus package, What we know about New Mexico is that about $1.4 billion has made its way into the hands of exactly 8,277 businesses. Interestingly enough, I can't really tell which sectors received that support. I think that they were working so diligently to get that money out from the Small Business Administration, so something I don't have direct control over. No state did. It was operated by the federal government through local lending institutions. That's important information for us to get our arms around so that we can look for other mechanisms to support other businesses. All right, so that's still good news. $1.4 billion is going to make a difference, and it has. To put that in perspective, however, New Mexico is home to nearly 40,000 small businesses. So we have a long way to go. All right, so we've got about $350 billion is making its way around the country. A portion of that is now available in the second stimulus to New Mexico. That means that more money is going to flow through the Small Business Administration and right back to the banks. Two-part message. If you're a business that already applied and did that paperwork through a bank and the Small Business Administration, you need to immediately contact your lender again and make sure that you're in the queue, because that money is coming. If you haven't yet applied, go to sba.gov, get those applications in, work with your accountants. If you don't have an accountant, if you're the owner and the accountant, you need to make sure that you are immediately reaching out to your lending institutions. It requires both efforts, and we're happy to help, and we'll make sure that we pull up our slide at the end that has all of our contact information. We're happy to help navigate. You still have to work with local lenders. You still have to work with the Small Business Administration, but let's get as many businesses into the PPP program. That is the Paycheck Protection Program. That's that $1.4 billion that went to 8,000 plus businesses. It's a loan on the front end so that you're keeping your employees, and then it's forgiven if you're able to manage maintaining those employees at the back end. It's an incredible benefit to small local business. I wanted to make sure that you knew about that and that we're ready to rock and roll. And the next set of applications, right, they're going to be open for the next set 8:30 on Monday. So you got to get ready for folks who have not yet applied. 8:30 on Monday. All right, I really wanted to make sure that we got that information out. All right, now I'm going to do a quick slide and we're going to get to unemployment. I wanted you to see that we've got incredible charitable efforts. I really want to thank all of the individuals that have helped put together this All Together New Mexico Fund. You can see that we've raised about $3.5 million, and I wanted to give you a sense about where that's going. And in fact, a large percentage of that is in fact going to food banks. Now, we are engaged in distributing food in ways that I think were really hard to contemplate by any policymaker anywhere in the country here too. I'm sure you've seen in other states the long lines. We're trying to make sure that we have distribution sites where we bring food to local areas, including sovereign nations, minimizing people having to drive to get it, minimizes infection spread, but also makes available right where you are getting necessary food. So we've got $550,000 today that went to these food banks. I want to give you a sense about where. Clovis, Food Bank of Eastern New Mexico. Farmington, it's the Echo Food Bank. Gallup, it's the Community Pantry. Northern New Mexico, the Food Depot. Central and Southern New Mexico, it's the Roadrunner Food Bank. Now we're going to keep dealing with food insecurity. If you're able to donate, go to alltogethernm.org. Alltogethernm.org. I want to thank all of our donors and partners, and I want to thank the food banks, the National Guard, our nutrition preparers. Those are the folks who work for school nutrition programs, all of the people in public education and the senior programs and the community service programs statewide who have been preparing thousands of meals every single day and getting them in the hands of all of our children and needy families all across the state. You should expect us to keep doing that work for the long haul. All right, quickly, and then I'm going to go to unemployment. Let's put up the slide about economic recovery. Oh, that one's fine too. You can see that we practice this to a high degree before we do it. It's a lot of information. This is going to be up on our website. I'm not going to go through it all, but I just want to give you a sense that we track, and I talked about them already. There is a small business support helpline at our economic development department. We'll make sure that you've got access to that at the end of this press conference. I already talked about the federal program, right? That's the Paycheck Protection Program. But now if you go to the state, it says state zero and low interest loans for small business. I want to point out that before we got federal money, again, it's not a competition. We're going to need every bit of investments from all sources possible. But I want to point out that we've been providing small business investment through the Small Business Investment Corporation, about $35 million. These loans are at 3.7%. We know that it's tough to get a loan when you don't know where your income is going to come from, but we think that these can be stabilizing. We've launched a New Mexico Recovery Fund through the State Investment Council, really intended for medium-sized New Mexico-based businesses. It's $100 million. We've also used through the Economic Development Department 2 different areas. One's called LEDA. It's our local economic development fund, but we're using it to leverage money to get it out to you. So I just really wanted to point out that if you're a small or medium, even big-sized business, if you think there's a mechanism for us to help you immediately, please reach out to us. We want folks to stay employed even if it's not quite business as usual. There should be one more slide. Nope, that's unemployment. So I don't know where. I have a slide and I'm not going to worry about it. I wanted the Mexicans to see, so we'll just get it up on our website. It really shows that when you look at the flattening of the curve, you can show that before COVID-19, you can see this huge bar graph of economic activity. Then the second we have our public health orders, so we know the impact, that drops. We're going to start tracking now. What does it take? What do we need to do week by week that gets us to that full economic activity again? I really wanted that visual. It's a very valuable visual for me because it tells me that if I don't hurry up, all of us, then we delay so long that we may not be able to have the same opportunity in recovery. Is that a message to immediately go back to work? No. Is it a message that my public health orders have expired? No. Is it any different than the stay at home, shelter in place? It is not. We're saving lives, but we're beginning to figure out how we can move in that direction. So with that, I'm now going to ask Secretary McCamley to go through unemployment so people know about those benefits, know where we are, and that New Mexicans know that we are clear. It's been really hard. Not only hard to find out that you can't go to work and that you've been laid off or furloughed, but it also means that our system wasn't ready for you. And it meant that too many New Mexicans have been caught in a cycle where they couldn't quite get access to those benefits. And we are aware and clear and working every day to solve that. And I do think we've made incredible progress, and the Secretary will tell you that, but there's more to be done. And we want to keep hearing from you because we want it fixed, and we want everyone to get every bit of benefit that you're both entitled to and that you need in order to make it through this public health emergency. So with that, Secretary, I'm going to go to you.
Thank you, Governor. So before we start with the presentation, I would like to echo Governor Lujan Grisham's statement. We are very, very sorry for all of the frustration that people have felt working through the unemployment system. If you're in the traditional program and you've had to wait for hours on the phone, calling numerous times before you get to anybody, we hear you. If you are self-employed, if you're someone who's run out of their benefits and have been waiting and waiting and waiting for the opportunity to apply, we hear you. I am so sorry. We are so sorry that you're going through this. And I just want to tell you, our promise to you is that we are working constantly, every single day, to get better, to add more resources, so at the end of the day, we can put money in your pockets so you can do, as the governor said, stay home and stay safe. So if we can start with the first slide, please. Just want to give you some context on where we're at now versus where we were just a few months ago. So in January, we had about 9,600 New Mexicans per week on unemployment. And that varies a little bit with different months. Obviously, in December, it goes up a little bit as school gets out and bus drivers and cafeteria workers get on and then get back off when they go back to work. But that's the number we were roughly looking at. We had roughly 650 to 800 applications for new unemployment benefits every week. Fast forward to March 15th, and since then, we are seeing now 79,806 New Mexicans that are receiving benefits as of Wednesday night. We've had 123,816 applications in that period. And if we can go to the next slide, just to put this into context, this is a graph showing those numbers. And you can see it's very, very steady for a long period of time throughout the fall and into February. We were actually pretty happy that the rate was going down a little bit every month. But as we see starting in March, those numbers go up, and they go up a lot. And so we've been working very hard to catch up, and I'd like to talk a little bit about how we are doing that. So if we go to the next slide, please. What's the first thing that we're doing? First thing is we're expanding capacity. One of the first things that we heard was a frustration, as I talked about when we started, were people's frustrations in trying to be able to get through to the call center. So since March 15th, we have been adding new staff almost daily to our call center operation. We've added 145 staff, many of whom are coming from other state agencies. So we've got Human Services Department, thank you, Dr. Scrace. We've got Department of Transportation, Cultural Affairs, Tourism. State employees have really stepped up to the plate to say, here is the need. This is where we've got to go right now. And we have been crash training them, getting them the technology they need to work from home, and they have gotten on the phones and allowed us to take a lot more calls from New Mexicans than we were at the beginning of the year. Secondly, we've added 80 staff to our adjudication process. Now, I don't want to use a lot of jargon. What does adjudication mean? It means when you enter into the unemployment process, you've got to both have all the I's dotted and T's crossed in terms of your application with the federal government, and we have to make sure that the data you give us on the wages that you're submitting line up with the data that we're getting on the wages your employer submits. Now, this process can sometimes take a while, and what we've done is add staff, both from other state agencies, and we've actually brought a few retirees from our department back to help us move that process along. That's one of the things that we found is 3 or 4 weeks ago, we found a lot of people were getting into the system. It was that process that was taking a while, and we're working really hard not only to add staff to the call center, but help process claims as they go through to help people get their money. We've also expanded the hours for the call center. Up till a few weeks ago, it was from 8 to 4:30 every day. We have expanded that from 7 a.m. to 7 p.m. Next slide, please. Thank you. We're also looking at technology help to make sure that people can get more of their benefits faster. So what does that mean? Number one, one of the first things we did was streamlined our login process. Under traditional unemployment, you are required to do what is called a work search. And so what our program did before was you logged in not only to the unemployment section, but also to the job search feature on our website. Well, we waived the work search requirements on March 15th. It's one of the first things that we did, and we found that people were having trouble getting into both of those systems. So we separated those systems back out and made applying online a much simpler and easier process. We are doing a much, much better job of communicating to the public what the specifics they need are. So we actually created a Facebook page. We didn't have one before. We've done much better on Twitter. I want to thank all the press out there that have been helping us get our messaging out on an example that I'm going to talk about in a second, which is certification. We've also started a text message notification procedure. So just this last Sunday, we sent out 10,211 text messages to people who are in the unemployment system that have not certified. Now, what does that mean? Once you get into the system and approved, you still have to certify your benefits every single week. Show us that you're not actually back to work. If you don't do that, we can't get you your money. Well, we had a lot of people that were in the system, maybe not familiar with it, that weren't certifying. So we sent out those over 10,000 text messages, combined with the social media work, combined with the messaging that our media partners were helping us put out. From last week to this week, that number has come down 50%. And so we're doing everything we can to get the message out on how this works at the place where you're at. A lot of time that's on your phone. We added a chat bot feature to our website. So we are encouraging people, if they can, to go online to jobs.state.nm.us. A lot of folks have had frustration getting through on the phone. We've added a computer program that says, here are our 15 most commonly asked questions. A lot of people can get their information there. And the next subject down, we're working very, very hard to add an online chat feature. So once we get everyone trained to be on the phones, which is where the need is right now, and we finish that training at the end of next week, we're going to work really hard to get some of those folks trained on an online chat service, because that can a lot of times be a much more efficient, effective way for people to get the information they need rather than having to wait on the phone all day. Last thing, we've had a real good success creating YouTube videos basically on a how-to direction process. So if you don't know how to apply online, you can go to our YouTube site. It's YouTube/NMDWS, and see about a 10-minute step-by-step directional piece on how to go apply for unemployment benefits online. You can go to another one that's a lot shorter on how to certify your benefits online, the thing I talked about earlier, where you've got to do that every week. So we're working very, very hard to use all the technological tools at our disposal to help people get the services they need. If we can go to the next slide, please. Responding to claimants. So the thing that we're probably most proud about right now is we've started this auto adjudication process. So in the past, we would go through and, as I said, adjudicate, process claims one by one by one. Well, a lot of the people that are applying now are actually in large groups. And so what we've done is said, okay, if you're in a group that is having this issue, instead of going one by one and having individuals have to deal with every single application, we're going to put you in chunks, and we're going to use the technological tools at our disposal to start approving you in groups. We started that last week, and just over this last weekend, we got 24,000 New Mexicans between Thursday and Tuesday the ability to start receiving claims this week that we didn't have the week before. That process is now part of our system. We've kind of had to invent it as the COVID-19 situation goes along, but it is part of our system, and it will help us get people through the system faster and more efficiently than they were before. Last week, we've removed the waiting week. So traditionally in unemployment, you have to wait a week between when you apply and when you get your benefits. That is a long tradition that didn't really have a reason to exist anymore, so we've got rid of that. And 2 weeks ago, when we got rid of that, not only does that allow people that are applying for the system to get their benefits faster, but we moved up the schedule of unemployment. So last week, if you had been in the system since the 15th of March, you actually got 2 benefit payments in a week, allowing us to get more money in your pocket when you need it, which is right now. Before I go on to the next slide, I also want to take this opportunity to thank the staff at Workforce Solutions. Almost everybody's working overtime. Our call center folks are in there early in the morning, waiting late at night. The folks that are doing those adjudications, the processing, we're offering as much overtime as they can take, and they're taking it and coming in the evenings and the nights, coming in on Saturdays. We've got people from our department that are doing a lot of things that they didn't really sign up to do. Almost 50 of our staff that work regional offices have actually volunteered to go and take calls because they know that's where the need is. Our IT folks are staying up till all hours of the morning, making sure that our website stays up and functional. We've had people from our AmeriCorps program, paralegals, going down and helping in our mail room. We've got about 10 times the amount of normal mail and faxes coming in that we normally have. And we really want to thank a lot of the state workers from other agencies that have agreed to come and help us out. Human Services Division, the folks over at Transportation, the folks at Tax and Rev, Cultural Affairs, all of you folks, thank you, thank you, thank you so much for all the hard work that you allow us to do. And to the staff at Workforce Solutions, I have never been so proud to work with a team. You are treating people with pride, with dignity, and with compassion, and it's appreciated. To the next slide, please. At the end of the day, what are we trying to do? We're trying to do what the message that Governor Lujan Grisham has been saying over and over and over again. Stay home, stay safe. And to do that, we need to get you money in your pocket so you can pay your bills. This graph shows the difference in money going out from the unemployment program throughout all of the fall, the winter, and into the early spring. It's in that roughly $10 to $15 million a month territory. Well, over the last month, that's changed. And that number that you've got, the $165 million through April 20th, that's money that's not only from the traditional unemployment program, but from the extra $600 plus-up program that was just instituted this week from the federal CARES Act that was passed in late March. So people that were on the program starting in the last week of March, starting March 29th, are going to get, well, they did get this last week, $1,200 into their bank account to make up for the week of March 29th and April 5th. And then starting from here on out, every single person who is getting any kind of unemployment through the traditional program or the pandemic unemployment assistance program that I'm going to talk about in a second is going to get that additional $600 added to their weekly benefit through the end of July. So as you can see, more money is going out the door. That's our job, and we're going to continue to try to do better to make sure folks have the resources to stay home and stay safe. We can move to the next slide, please. So this is what we're working at going into the future. The Pandemic Unemployment Assistance Program was set up to help people that don't normally qualify for unemployment. So what does that mean? The Unemployment Trust Fund for the state, which is the fund that gives out benefits, is paid for by payroll taxes. So if you're a W-2 employee, you work for a store, you work for a restaurant or whatever, you're paying your taxes, and your employer then pays payroll taxes into the fund. If you're self-employed, you don't pay taxes into that fund, and so you haven't been eligible for unemployment. If you are otherwise monetarily ineligible, which means you didn't make enough money in the past 18 months to qualify for unemployment, you haven't been able to get unemployment either. Well, that's about to change. So let's go through the scenario that we're going to go into next week through the shoes of 4 different New Mexicans. So that first box up there on the top left, what is that? I'm getting unemployment now. Do I need to do anything? No. You just certify every single week, and you're going to continue to get benefits through both your normal dollar amounts plus the $600 extra until the end of July until you run out. Okay, let's say that you were laid off recently and you want to apply. Go ahead and apply for unemployment. If you were monetarily ineligible because you didn't make enough in the past 18 months, you will go into the Pandemic Unemployment Assistance Program, which starts on the internet on Sunday, and we can take phone calls about it on Monday. If you are eligible for unemployment, you're going to stay in the regular lane and you're going to go through the regular process. The next box over. This is the group of people that have, I think, been some of the most frustrated. Our gig economy workers, folks driving Lyft and Uber, veterinary technicians that are working contracts on racetracks, massage therapists that are working contract at the local spas, artists, food truck operators. If you're an employee that is self-employed, realtors, starting this week, you will now qualify for pandemic unemployment assistance, and you got to do the same process. You're going to go through and apply regularly. And we've been asking people over the last couple of days to get their applications in to jobs.state.nm.us. You're going to be deemed monetarily ineligible, and that's okay because that's part of the process. Starting on Sunday, if you've got an account online, you're going to see an extra button on your account that's going to allow you to go to a different form where you're going to be asked to fill out some personal information, answer a few questions, and upload tax data. That's going to be whatever document you give to the federal government. So for most people, that's going to be their 1040 form. I had a realtor actually, though, ask me the other day. She says, I fill out a form 1120 because I'm a C corporation and that's how I get my money from my company. That's okay too. Whatever document you use to tell the IRS, this is how much money I make, that's what you want to upload to the program. And then you complete that document, you'll be in the Pandemic Unemployment Assistance Program, and we'll be able to adjudicate, which is process that fairly quickly. Some folks should actually start seeing their benefits next week through that program if they get in early. The last group of people are the people that have had their benefits run out. So in traditional unemployment, you only get unemployment for 26 weeks. Part of that Federal CARES Act, though, allows us to extend unemployment for an additional 13 weeks. So if you've run out already You're going to have to go in starting Sunday and fill out another little form saying, hey, I need to extend my benefits, and you're going to get the same benefits you got before, and you can backdate it to March 29th and get your benefits plus $600. If you're already on unemployment and are going to run out, you shouldn't have to do anything. That should automatically extend. And there's one thing I missed on there before we leave. I want to make sure that the self-employed folks know you can actually backdate your claim to when you lost your job. So let's say you were a massage therapist at one of the spas in the state, and on March 18th, that's when the order went into effect saying, hey, we want to close these because we want to keep people healthy. Well, March 19th is the first day you weren't working. You can backdate your claim to that date and receive benefits from then moving forward. So thank you very much for taking the opportunity to listen to this. Once again, we are very, very sorry for the frustration many of you have faced going into this program. We take responsibility for these actions. We are working hard every single day to improve our systems, add more resources, and make sure that we can give you the resources that you need to get through this safely and effectively. And our goal is to be the best department in the country that gets the most people, the most dollars moving forward. Governor, thank you very much.
All right, thank you, Secretary. I'm actually going to remind folks about one thing. I don't know if you are like me, but even in some of these slides and presentations, you know, I need it to be simple, straightforward. I don't understand why any government, local, tribal, state, federal, it should be easy. I just call up, I give you this, I certify, it's an affidavit. You know that I'm not employed. You told me I couldn't go to work. So you should have all the records about all those businesses. I should just get a check. We, in the state of New Mexico, agree with you. But we have to follow the federal requirements. All right? I don't choose those. The Secretary does not choose those arduous efforts. I'll defend the federal government. There is an audit. It's your money. We have to make sure it's getting to the folks it's intended to get to. So the combination of making sure that we deal with it appropriately, that we are doing it correctly, that there's no fraud involved by anyone, anywhere in the country, isn't easy. And I think the federal government has learned that this can be easier, and that may be a long-term silver lining by this terrible public health crisis. We can make these systems easier. They also didn't fund or allow us to recapture updating and upgrading any of our IT systems, right? So we've just been managing 10,000 people a month on a telephone. Well, that's manageable. But even though these are repeat callers, when you get 3.5 million calls into a system, and we're still required to go through, right, this application, this adjudication, it's been really tough. And to every New Mexican who didn't give up, and to every worker who hung in there, and we are getting these systems collapsed into something that's much more user-friendly and productive, and less time and attention by an individual, so we can just get you those benefits. I appreciate the Secretary's sentiments. We don't want to be in that position. We want you to be made as whole as you can. That's the reason we have unemployment insurance and a benefit program. So we want to make it easier and easier, so there might be changes, you'll get notice about them, but we're trying to work with the feds to make it as simple as we can. You deserve that it's simple, straightforward, and easy to access. So thank you for your patience, and we really wanted some time to give you a sense about, my goodness, why is this so challenging? And I hope that gave you a good picture and gave you a sense that when we're processing or adjudicating in a weekend 20,000 plus applications, we're serious about getting it done. Now we have Dr. Scrace here, and Dr. Scrace, do you have a presentation at all today?
No.
He's just here making sure that if there are questions, and I actually appreciate that. We spend a lot of time together, safely, socially distanced, having WebEx meetings and wearing our masks because this information and data is relevant and important. And with that, let's just go to questions.
Thank you, Governor. All right, first we're going to go to Dan Boyd with the Office of the Journal. Dan, you are unmuted. Go ahead and ask your question.
Yeah, thanks. Good afternoon, Secretary McCamley and Governor. Wanted to follow up a little on the unemployment stuff, the status of the unemployment trust fund, kind of what that dollar amount is, and if there's concern about that fund being depleted.
Yes. We'll go to the Secretary.
Thank you, Governor. So I'm going to get that number for you right now. We thought that number might come up. The number started in mid-March at around $465 million. As of this morning, the number is $397.5 million. Now, that number has come down over that time, and that's actually a good thing because it means money's getting into people's pockets right now. It's going to keep coming down for a while. We do have options that we can explore with the federal government to make sure that we get money back into that fund so that people can continue to receive unemployment benefits. And people receiving unemployment benefits should not worry. We will explore those options. We will make sure money is in there, and we will make sure that we can make sure that our obligations are being met.
Thank you, Secretary. But fair point, right? No money coming in, money going out. There's an obvious math problem there, but we are aware. We track it all the time. We won't let anything collapse that would create stalling getting benefits to New Mexicans. And every state is in this situation, and that message has been received loud and clear by our federal partners and by appropriators in Congress.
Thank you, Governor and Secretaries. Next, I'm going to go to Brandon Evans with KRQE. Brandon, you're unmuted. Go ahead and ask your question.
Good afternoon, everyone. I have three actual questions, and if you can do them in order or out of order, I appreciate it. But the first one is elective surgeries potentially coming back, cancer screening, stuff like that. Are you worried about a backlog and what's being done to maybe address that? The second question, expediting state tax returns. Is that something you guys are looking into? And the third one about the PPE, or the Triple P, the Paycheck Protection Program. A little bit more information about that, because I think that some business owners might be confused about what their employees are getting paid versus what they would have to pay them to come back. So can you talk about those three things, please? Thank you.
I can. So thank you for the question. So the first, the elective surgeries, and that is a very important question, and I really appreciate that it's being asked, and that New Mexicans and hospitals have been really concerned about that. Two quick facts. All hospitals have what they identify as elective procedures or surgeries, and it's the way in which they bill insurance, the way in which they bill grant partners or patients, and how they schedule, right, surgical time and the number of individuals that you need available in any healthcare delivery system to meet that need. So the way we talk about it, and I was cautioned about that by someone, the notion by a lot of folks with all the national media about this pandemic and what's happening in hospitals is that, you know, folks can't get plastic surgery of some kind. And this is a broad range of services that don't relate to a trauma, an emergency room procedure or issue, and that's how it gets classified. So it's a broad range of screening and related services. New Mexico, like many other, I think all states, if you had to be ready for surge capacity and peak capacity, which means you needed every available hospital bed, and more importantly, or maybe as importantly, the drugs and the equipment that you use for some of these screenings and procedures like a colonoscopy, those anesthesia drugs and that PPE is required to meet the need to treat COVID-19 patients. So that's why it wasn't just space, it was also needing professionals, their drugs, and the equipment that is necessary to safely provide many of those procedures. So that's why all states, including this one, made that decision. Next, just a reminder, we followed guidelines from the CDC, Centers for Disease Control, and the American Medical Association. Why is that important? Because it is a pretty broad bit of guidance that gets to, which was not only identified, but we've kept clarifying in our order, and I really want to do this. If you're a practitioner or you're a patient and you need a procedure and you're concerned about waiting for that procedure, this order is not intended to tell your physician or your practitioner that he or she cannot perform that, right? It's a management tool to allow us to make sure that we can meet capacity, have access to all of those efforts. So it's not an automatic in terms of scheduling, but I don't want anyone who's in pain or is scared or concerned or a practitioner to feel like they can't independently make those decisions. They can, and they should all along. So I want to make sure that we reiterate that. Now the question. So if we're flattening the curve and maybe you don't need all of those beds, are we in a position, and maybe regionally, to maybe ease up on elective surgeries? So I didn't really talk to you about how my Economic Recovery Council went today. It went very well. We had our first meeting, and we talked about the categories and areas where we want to start taking a look. That category came up. It's also being reviewed by the medical advisory team, which is, chaired by Dr. Grace and others who really look at that, because we believe it may be time to think about ways or even whole categories that might need what we're calling today an easing of those restrictions. So too early to make a decision, but we're in the process of that evaluation. And we hope that we'll have information about what we can do early next week. And I think Dr. Grace may want to add to that.
Yeah, I just wanted to say I think you hit all the important points, Governor, but I wanted to add too that we have brought up a new committee in the medical advisory team to look at reopening, what that means for healthcare, what that means for the state. We talked Wednesday that step one is the state has to be ready, and we talked about gating criteria and testing and cases stabilizing and able to do contact tracing and workforce health and hospitals not being full. So that's step one. But the first thing that actually this work group is looking at now is elective surgeries. Rohini McKee, who's a colorectal surgeon, has been appointed the chief of that group. She actually worked with HSD as a fellow over the past 6 months, so she's very familiar with the interface between state government, public policy, and of course medicine. And we, as the governor said, we are looking for preliminary recommendations. I think that this is a very important source of livelihood for hospitals and for employees, and so we understand that if you reduce revenues by 40 or 50%, that's going to be a problem, and particularly when those institutions are the ones we are relying on to take care of all of us in New Mexico who acquire the COVID infection. So we're making great progress. I think we established those gating criteria. You'll hear more about that next week. We'll have some preliminary recommendations, and when the state is ready, I think that you're right on that question that elective surgery is one of those things near the top of the list. Thank you.
And these questions give us an opportunity to really talk about a whole host of things that we deal with every day. But how does this relate maybe to testing, which wasn't part of your question, but it's related. If we can't do the kind of healthcare worker testing, imagine if you have an asymptomatic healthcare worker who is involved in one of those procedures and you infect someone with COVID-19 and you infect an operating theater. Vice versa. If you had an asymptomatic individual who didn't get tested for COVID-19 or who used just a blood test, a serology test, and you got a false negative, there's incredible challenges and, quite frankly, incredible liabilities to that. So again, don't want to scare anyone. This is a state that's got incredible expertise. They have to deal with those infectious disease issues when they do any procedure already. And our medical community is well versed in doing that. They test for flu, they test for any number of infectious diseases, we're clear. But you have readily available testing, vaccines, and treatments for that. We don't have it for COVID-19. So it's a different threshold. So there's a whole lot of issues that are embedded in what seems, for I think so many Americans and New Mexicans, if I was getting this screening, or it's now time for me to get a colonoscopy, why am I being denied? And I just want folks to realize there are a lot of complexities that really are intended to keeping all of us safe. But that does not mean that we don't think that there's some room now to begin to explore some options and the medical experts will advise and make those recommendations to me. And I take very seriously that thorough and thoughtful work, and I believe in science. And so I pay attention to what the scientists and doctors advise, and that's typically what you see in our decision making. You asked me a little bit about PPP, which gets to, there's a lot of confusion, PPE and PPP. PPE is personal protective equipment. That's the face shields and masks and respirators and gowns and gloves. And we continue to get those orders in. If we are using too much, if too many patients, we won't have enough. Today, we have a high degree of confidence about what we have available, not just for hospital workers and first responders, but for more folks who are in at-risk delivery systems, right, like grocery store workers and other essential businesses. So we're feeling good. That could change any moment. It depends on what comes in and what's going on around the globe and around the country. But you wanted some more information about PPP. That's the Paycheck Protection Program. That's a program that was created in the first round of stimulus funding that we talk about, the Federal CARES Act. That's the title of that federal piece of legislation, nearly $1 trillion out to all of the states. And in that set of initial funding, there was money set aside for businesses, and each state got an allocation. We didn't know what those allocations were going to look like. They came through the Small Business Administration. They didn't come through the state, any states. Small business worked with local bankers. Local bankers then, with applications, worked with businesses to receive those investments. It's identified as a loan, but the loan is tied specifically to having your employees. And I think your question came to, how are you going to reconcile if their employees are currently on unemployment and they hire them all back? And then they have to keep them. That's how they don't have to pay the money back. Is there a way to reconcile that? There is. Could that create any glitches? I'm sure it can. And we have to cross those bridges as we get to them. An interesting thing, though, I want you to know, because you said more details about that. We don't have very many details, right? We aren't getting information from the feds. And then why is that important? Why is it important for us to know what categories, maybe even the businesses? Those success strategies help us get more money out, close the gaps. But I'll tell you what else it will show us. There is a sense that states with either the same population or lower population, or maybe just a bit more population, like Nebraska, that they got 7 times the amount of money in that PPP, Paycheck Protection Program, really small business support, than New Mexico did. Now, how does that work? Because the way the federal government works is often on a population per capita basis. So they have because otherwise they're picking and choosing one state over another. And so there are very clear federal rules and guidelines, and it does not appear so far that those were followed. States like this one are aggressively trying to get more information. So we want to know in this next round, this $350 billion, which has got about $60 billion set aside for smaller businesses, rural businesses, smaller lending institutions, also has, you didn't ask me this, $11 billion for testing, because you might ask, how are we paying for all this testing? It's becoming a real challenge for states who don't have money coming in. We need the federal government to provide that support. They are. But there's some real questions that we have as well about why we don't know exactly how this money's being allocated, how it's being utilized and supported, and how we can reconcile that effort. And so this is what we know. And the message is, if we can help businesses make sure that they follow and they get those rules, right, and when they do the application. But that's basically the rule. We'll give you up to a $10 million loan. You have to, it's got to be tied to what you're spending in payroll. It's intended to have employees and to bring those employees back. And then if you do that, then of course that's forgiven. And so that's the basic construct of that program. Bill, Secretary McCamley, am I missing anything that you think is valuable for this answer?
Thank you, Governor. So, yeah, one of the issues that comes up with unemployment is that you are technically not allowed, actually, to refuse work if it comes back to you. So one of the things that we're trying to work with employers on in this situation is to see if they can actually schedule hours for their employees to come back that allows them to be underneath where their maximum benefit is. That would allow them to stay on unemployment, even if it's only a little bit, and get the extra $600 moving forward. And that's how we're beginning this conversation, try to work ourselves in that way. But the governor's right. We're actually working with our state Association of Workforce Agencies to try to really find better strategies of making these programs work together. And we're going to be doing that moving forward and hopefully coming up with some better advice for our businesses and our workers.
Thank you.
The third was tax returns.
Oh, that, how well, thank you. I got reminded that you had a third question. So, Tax and Rev Department, even though we have, deferred the deadlines for income tax and we're working on any number of changes, we are going to be on time with tax refunds. If you're entitled to a tax refund, you should apply so that we can get that out to you. We don't expect any glitches there at all. And we continue to look for ways within our constitutional and statutory requirements, they're pretty narrow for most states, including New Mexico, to assist taxpayers in any way. And so I hope that that was the genesis of the question, and if not, at the end, please ask again and we'll get to any of the specifics that you have.
Thank you, Governor. Next, we're going to go to Algernon Damassa with the Las Cruces Sun News. Algernon, you're unmuted. Go ahead and ask your question.
Thank you, Governor and Secretaries. At least one community down here in Doña Ana County has reported an upward trend in domestic violence incidents and other signs of desperation and stress related to the conditions of the stay-at-home orders and the economic pressure caused by COVID-19. And we're just wondering if state agencies are planning for building capacity to deal with behavioral health issues and other related conditions related to signs of economic and social desperation.
So I'm going to do a quick answer, and I can see my peripheral vision. I can tell when a cabinet secretary is ready to add value, and this is exactly why you have experts, including behavioral health experts. But the answer is yes. We're aware that this is a high-risk situation in any number of ways. We know that social isolation can contribute to or create conditions of depression and risk that even in school-age children who don't have the same socialization and access to their friends and educators. There's even now models of study for educators who are finding that being disconnected from their vocation and passion in this way, and that even with distance learning, it's just they don't have that interaction and connection, and it causes a negative behavioral health context. This is also a state that, due to socioeconomic factors that are quite challenging, that we have higher risk factors, right? Poverty, isolation, limited access to healthcare services, and now add to that that this is a state that completely eroded purposely all of its behavioral health in the last administration. Right? And that meant that we have been building it up, and this was the year where we received, and thank you, to every New Mexican that supported your legislators and appropriators to put in tens of millions of dollars into standing up a behavioral health system, and we recruited. And we're working with any number of behavioral health individuals to provide direct services. And in the issue that you identified, domestic violence, we have a higher than national rate of that issue. It's an incredibly difficult and challenging issue, making sure that we've got safe isolation sites for families to deal with that today. We do. We want to make sure that families can maintain the social distancing, but they have to be safe. We cannot allow domestic violence or child abuse to occur anywhere, and we have systems to address that. But I want to make sure this is a team that is well aware that got squeezed And those pressures got enhanced, right, for a population that's high risk. And we're aware. So I do think, yes, we're building capacity. We've launched, an online effort. We've got telehealth available. But we are, of course, very concerned about these risk factors. And we ask people to contact us when you have these high risk factors and allow us to support you in any number of ways that reduce risk, to support family members and children who are in these situations. And we are very concerned, and we know there's an uptick. And I'm going to go to Dr. Grace.
Thank you, Governor. It would be expected at a time like this, in the stress of a pandemic, to see an increase in behavioral health issues among all of us. In fact, the medical literature is now showing that that's a big situation in other countries who are now on the downward slope of their curve. And so the governor's exactly right that we have been preparing and expanding behavioral health before the pandemic started. Immediately, I think it went into effect maybe March 18th, we raised the Medicaid payment rate for telemedicine to the same level as going in to see your doctor to keep you safe, but to get help. This sort of pandemic also brings out and exposes underlying substance abuse issues in communities, and we've been working very hard on that as well. And our providers have been fantastic. We've been calling them, asking them for help, asking them to go to other cities to help. Everybody has been very responsive. But if you're at home today and you're feeling angry and frustrated and feeling that sense of lack of control that I think everyone in New Mexico feels, at least to some degree, during a pandemic like this, there are some numbers you can call. We have 2 toll-free crisis hotline numbers. The first for everybody is 855-662-7474. Again, 855-662-7474. And these are on the website as well. And then for healthcare workers who are under an enormous amount of stress, as we mentioned the other day, we have another number, 855-507-550, can't read my own handwriting, which is a occupational hazard of a doctor. 5509, sorry. And so please call. We have people who want to help. You're not alone in a situation like this. Your neighbors, your friends, the folks your kids go to school with are all facing these kind of challenges. Just even being cooped up in a house can be stressful, and add to that, not having a job or not having the right amount of income. So don't be embarrassed at all. We would love it if you'd reach out, give us a call. There are people you can talk to who can help walk you through some of your options and finding ways to get even more help. So thank you very much for that question. It's a very, very important question at this time for us here in New Mexico.
Thank you, Governor. Next, we're going to go to Morgan Lee with the AP. Morgan, you are unmuted. Go ahead and ask your question.
Hi, thank you for this forum today. I wanted to ask what, if anything, the state might do in terms of supporting local government. And as you know, cities, counties can't deficit spend. Are you concerned taking any action about possible layoffs, furloughs, as local governments see revenues plummeting? Thank you.
That's an easy answer. Absolutely, we're concerned. We are in contact with local governments pretty consistently, and it's one of the reasons, not the only reason, that we've got a mayor's council that we're working. I don't think it's established yet, but I believe that decision's either gets announced today or early during the weekend or Monday morning. It's pretty ready. I know that they're just contacting mayors is the only reason. I don't want to before someone agrees to be on the mayor's council with the chief of staff, I would never put them in a tough spot. But they are in really the same dire economic situation. And let's talk about what mayors have to do. I know there's a lot of sense by individuals who have lost their jobs and they have real economic insecurity, this notion, well, I don't know why government gets any resources whatsoever in the CARES Act or anywhere else. Well, remember, right? That's who is picking up your garbage every day. That's who's making sure that we have clean water every day, making sure that our wastewater systems are working every day. That's who pay the fire department, the police department. And I'm not trying to minimize the role and work of local governments in any other number of ways, including, right, they operate our jails. And I'm not giving them credit for all the other things that they do. Those are essential, necessary, required services. And if we have a downturn in the economy, that sales taxes aren't paid, right, any number of efforts, gross receipts taxes, aren't getting into the hands of local governments, that means that their budgets, right, are short, and yet they still have to pay all those bills. And you're exactly right that they're not in a situation where they've got the kind of either reserves or deficit spending short term. The state's not allowed to do that either, that they can manage or maneuver. So we're aware that city councils around the state are having conversations about furloughs and layoffs, right? Temporary work or completely laying off individuals. And that's not something we want. We're hoping that we can come up with strategies that avoid that until we build back economic recovery measures. Now, something to know in the CARES Act, that the allocations that come to states, and you know, New Mexico is in line for well more than $1 billion, that just under half of that is going into local governments. And while they can't backfill their budgets for not having, you know, these sorts of receipts coming in, they can, in fact, sort of stabilize where they are. And in the next set of stimulus, I'm sure some New Mexicans heard Senator McConnell say states, which is really a reflection of all government, they should just be bankrupt. Well, that is the worst idea ever. And it's really shameful that we're even having those kinds of debates. And there was a quick rebuke from Congress, bipartisan, and a quick review and statement by the Secretary of the Treasury, Mnuchin, saying, that's not going to happen. We're going to work together. And they are now very open to, in either the third or fourth stimulus investment, that it's going to allow local governments to fill those gaps. The question is, can we get that relief fast enough in their hands? Last thing about that question, we will have to have a special session. And that's, you know, I don't have a date certain. Again, it's tied to making health-related and economic-related decisions. But we anticipate that it's likely in that second week of June. And we should think about policies, and we will present them. Premature to have them for you today, but things about making sure that local governments know one state, one effort, and tribal governments are also in dire shape, given that their economic businesses, they also made decisions, which I applaud that leadership, to close their hotels and casinos as examples. And so everyone's got economic stress, and we're going to have to deal with it holistically, comprehensively together. So those are the strategies that we're undertaking.
Thank you, Governor. Next, we're going to go to Dominic Aragon with the Gallup Sun. Dominic, you are unmuted. Go ahead and ask your question.
Thank you, Governor. Thank you, everybody. Just two quick questions. First one, Rehoboth McKinley Christian Healthcare Services, a lot of sick people, and 11 employees have tested positive. What's being done to help rural hospitals, and what's being done to help secure PPE for the frontline workers? And my second question, given the comments out of grants this week, what action is state police planning on taking out there next week? Thank you.
All right, well, the first question is, I'm going to take that as an alert that we need to get PPE out to McKinley County. We have taken many shipments, and we should keep doing it. There seems to be, and I don't really have a good answer for it, a disconnect in that, you know, hospitals were also, and they did a good job, setting equipment aside. They also always purchase. But the whole supply chain around the country and the world has been interrupted. I'm actually very disappointed that the federal government didn't do a much better job not interrupting that system and creating, bolstering our opportunities. But be that as it may, we have, again, if we keep flattening the curve, I want to be really careful about this statement. If we don't manage this infection the way that we have been, then we will in fact be in a dire situation for personal protective equipment. And our frontline healthcare workers are a priority. So, Dr. Scrace, before this press conference is over, they will be loading up and finding out what we need. So thank you for that. And we got to make sure that they know that, it's really hard to take a moment when you're saving lives to make sure that someone in the hospital reaches out to us to say, we underestimated what we need more. So I'm just going to take that as that was helpful, and we appreciate it. And we want to also, I'm going to thank everyone in Gallup and McKinley Risk. They're working diligently to mitigate, to manage. That's why we put, 50 beds out there and are standing up an ancillary healthcare site. Also, we move people as appropriate, right, to other healthcare institutions, not because they do a better job, but because they have room, right? We need every patient taken care of in every single way that we can. We're going to keep doing that. And it's hard work. And I want to thank every healthcare worker, every first responder, and every citizen of McKinley County and resident of Gallup for really doing everything they can. Grants, I'm very disappointed in a couple of things. This notion that you can just open up businesses, that you don't have to follow, these orders are the law, you have to follow them. I take no pleasure in telling people that they have to stay home or in creating this kind of economic reality by saying you can't go to certain businesses. I hope what's happening in places in the northwestern region of the state gives people a sense this infection is here, it's dangerous and deadly, and it is spreading. And so this notion that you don't have to comply is wrong. Two, that you can just open up businesses and not worry about public health issues is really, quite frankly, tantamount to opening up a public pool and having a P section. This makes absolutely no sense whatsoever, flies in the face of every single positive, productive, evidence-based public health effort. And quite frankly, I happen to know that the county commission is incredibly upset by these decisions. I'm hearing from the Pueblo governors in that area. One governor's written a letter already saying they will not support those efforts. They don't, in fact, tolerate those efforts. And I hope it's a very strong rebuke to a mayor who I am sure meant well by saying, I stand with all of the workers and businesses. We do too. But you stand with them by keeping them safe, by following the rules, and by helping us productively, smartly, evidence-based, using our recovery councils, our mayor councils, to make sure that as we go back to some degree of normalcy, including getting people back to work, that we do that in a way that protects each and every one of us. And so I'm hopeful that everyone looking at those issues gets that message. And then lastly, and I take no pleasure in this either, if businesses open without specific instruction or permission in an order to do so, they will get a cease and desist citation. And those citations have fines that can be associated with them. And we have provided those cease and desist orders, and we'll do whatever it takes to keep New Mexico safe and to make sure that we're all doing it together in the right way. And I absolutely don't want that to occur. So I hope the mayor heeds all of our advice and walks back those statements.
Thank you, Governor. Next, we're going to go to Chris McKee with KRQE. Chris, you're unmuted. Go ahead and ask your question.
Thank you very much. I wanted to go back to one of the things the governor had said on Wednesday, saying, quote, we're going to go slowly, productively, proactively, steady, and we're not going to be pressured by nuances in other states, that in context of reopening. So to that end, other states, of course, we are seeing are reopening a little bit faster. Colorado is seeing the beginnings of a reopening next week. Texas seems to be imminently approaching a reopening as well. So with that being said, with the communities that we have in New Mexico along the border, and I think of communities like Farmington, that's pretty close to Colorado, Las Cruces, that's close to Texas, is there any concern, or are you worried about folks from New Mexico maybe being encouraged to travel to those states and do a little bit of the reopening sort of business mingling over there, and then potentially that bringing spread and coming back to New Mexico and back home. And one other quick question, given the doubling rate in McKinley County, is there a need for tougher restrictions and enforcement to stay at home? I think of something like a curfew or whatnot. Thank you.
So yes, you basically gave the whole statement. We are very concerned. And I know that it's that pressure for someone living right on the border to go shop and do retail or go to a movie in Arizona or Texas or Colorado. It must be incredibly compelling. And I worry greatly about the impact here. And, I think states are still really trying to navigate it. And I think that we're going to see data that indicates that, and we're aware of that when you ease these restrictions, you will have an increase. We just want to make sure that that increase is not so dramatic that too many lives are at stake. Otherwise, you go right back down. That's harder on individuals and on the economy. Start, stop, start, stop, start, stop. That is actually a disaster. So the best thing I can do is say, concerned, hope that we can get a regional design to some degree that's going to make sense. I don't know that we can do that. I think Colorado's moving so quickly that regional design may now not quite work for New Mexico. They also don't have the same risks that we're seeing in McKinley and San Juan County or those spikes. So I'm very nervous about that. It is a bit of a wait and see, but the message needs to be to New Mexicans. That temptation is real. I'm going to guess that some of the people right around this table, that temptation is real. Resist it. Please, please don't cross the border. How did this infection spread? Travel. People on planes, people in cars, people on buses, people on trains. I think I might have said that. That's how it spreads. So if you're traveling, you could get it and bring it back. You could take it. We absolutely cannot do that. And we think that our approach is going to be the approach that actually maybe other jurisdictions and states will start to take, which is a little bit more thoughtful and clear about gating and metrics and marrying good public health work with productive economic recovery work. They don't have to be entirely mutually exclusive, right? More PPE available for grocery stores and retailers potentially, and how we figure out distancing at restaurants. And somebody talked today at the Recovery Council, maybe with spring now and summer, we can have an outdoor environment that gives us less risk. These are all valid ideas and suggestions, but I'm concerned. And I think that was really your point. This is concerning, and I think it's going to be an interesting National Governors Association and actually the National Mayors Associations. This is a tough environment for all of us. And then I prefer to really talk about what we do in terms of containment and community support as a community support containment strategy. I think there is more that can be done in Gallup and McKinley County. We laid out, a number of options that included curfews where we can provide support with more personnel, behavioral health personnel, more National Guard individuals who can deliver meals and have things available for individuals because maybe they couldn't get to the grocery store because they go maybe during when a curfew would occur. Anything that softens that kind of aspect, we have to do both. I think that these communities have more options they could undertake. I think it's likely that they ask us to partner with them, particularly maybe even this weekend. And I am hopeful that we can support Gallup and McKinley County and other northwestern counties in that region to think about ways to proactively get ahead of the infection spread we're seeing in those areas. And so that was a kind of a long yes, but I think that that's probable. I can't speak to the locally elected leaders there, but I think it's probable. Dr. Grace.
Thanks, Governor. I want to connect a couple concepts for people that I think are really important at this critical juncture for our state. So just to be clear, we will have a steady flow of COVID infections in our state and in the United States and in the world until we're all vaccinated. So we're going to have those cases here. They're not going to just completely go away. Maybe we don't know if they'll be less in the summer or not. People are predicting worse in the winter. But the reason we got here today where we can think about taking that chance very carefully to live in a COVID positive world until the vaccine comes is because of the behavior of the people of New Mexico. Right. You've driven down the transmission rate, our doubling time is way up, our cases are leveling off. And so if everybody goes out and takes advantage of opening in other states and comes back, all of those numbers are going to flip and we won't actually meet the gating criteria to open. So if you want to open here, the best thing you can do, and I know I say this every time, is stay at home. Don't transmit the virus. And there's absolutely no amount of care that you can take to go, fly to Denver, or not picking on Denver, any city, and come back and think that there isn't a chance of infecting your family, your friends, your neighbors. And so we got here to the point that we're thinking about reopening because of what you did. Please keep doing that so we can meet those criteria and we can start that process. Thank you.
Well said, Dr. Grace. Thank you.
Thank you, Governor. Next, we're going to go to Michael Gerstein with the Santa Fe New Mexican. Michael, you're unmuted. Go ahead and ask your question.
We're thinking about. Can you hear me?
Can.
Hi, thanks for taking my question. Yeah, past couple of weeks we have been hearing about cases in nursing homes, and just wondered if you could give another update on the situation in nursing homes in Santa Fe. Thank you.
I think I can. I'm going to ask for assistance. So, Dr. Grace, will you look at the slides if you can find them, or ask Dominic, one of our folks? So we've been doing surveillance. Interestingly enough, as we do that, I was on a call with the White House this morning, and states are beginning to look at, they're trying to expand testing capacity, and it's really a two-part problem. They're right. I believe the national government has to take the lead in making testing to expand it across the country, and to make sure that there's a steady supply of the equipment that you need. And I mean the sampling supply, swabs in the medium. Then we're now looking at saliva tests, even better. I don't need a swab. They have to keep figuring out that effort. And why do they need to figure it out? Because they got to know that for all of that sampling, that when I identify an instrument that has a very particular reagent, those are enzymes that tell me whether the virus is present, they have to certify it. And then there's this whole effort to get the supplies to make it happen. We launched more than a week ago, recognizing we need to do surveillance. So before we get a COVID-19 positive, because a worker or a family member is concerned about hearing about that their mother or father or brother or sister isn't feeling well, seems to have the symptoms, or the nursing home, the medical director called us and we test you. We want to get in and do more surveillance. And so we've been expanding that to Santa Fe, Farmington, Albuquerque, Las Cruces. So we're getting into any number of nursing homes. And in fact, today I know that we were testing in. I don't know if you found that. If you haven't, I'll make sure I send it to you. I think 7 nursing homes we were in today. And I know that we were in about that many yesterday. And so I might have to get directly to you to tell you the correlation of positives in any of that surveillance testing that we did at any of those facilities, and something to tell and we're working closely with the long-term care or the nursing home association to identify where we go, how many folks, and we really want to do both, test residents and workers, so that we are dealing with that. The quicker we get ahead and know what's happening, the more lives we'll save. I know everybody knows this, but I'm going to say it. Not only is that high risk for infection spread because you're all together, it requires personal touching. You can't be six feet apart when you're providing personal care to someone, even with PPE. There's risk. And it's that age group and chronic care population that's most at risk for serious illness, critical care, and potentially death. And so we are very concerned about long-term care facilities. And so I don't know what you were able to find. Thank you, Dr. Grace.
So, Governor, as of yesterday, we have tested individuals in 26 different nursing homes or nursing long-term care facilities. In 13 of those nursing homes, we found positive cases. There's a total of 144 cases altogether in nursing homes. And I'm glad you brought up the point about the higher risk, because there's some data out of Europe just yesterday indicating that over 50% of the COVID deaths in Europe are people in nursing homes. And Dr. Smeltzer and I were talking on the phone from EPI today. We're at 38 out of 84 deaths, which is 45% of the deaths here in New Mexico are in nursing homes. And so very frail population, a trend that we're seeing all over the world. Really important to get them the support that they need. I know National Guard and others are working on cleaning facilities. And,
I forgot about that.
And really reaching out there. And again, more testing. We've been to a little over a third of the nursing facilities in the state so far, and the plan, as I understand it, is to get out to all of them.
Every single one, and I forgot that. That's a very important point by Dr. Scrace, but it shows you we get the data every morning. We typically go over it again in the evening. Michael, I'll make sure that the question as it relates to the Santa Fe facilities, that we let you know what we know about those facilities, again, without any personal identifying information for any individual. We'll get that to you, so I'm going to ask Nora to make sure, and Tripp, they're here in the room. We have very few people in the room, but make sure that that gets to you so you don't have to dig through all of the dashboard to get it. And we just, in the last couple of days, have completed efforts and training so that men and women in the National Guard can help us decontaminate and clean appropriately. That takes a whole specific effort, and I want to be careful. It's not that nursing homes are not doing that. They have a whole standard and a whole protocol. They've been required to do that all along. I'm gonna say it might have been inconsistently applied. That makes us very nervous. That's going to be a regulatory issue we'll look at. But in the meantime, we can help by making sure that we can get that done faster and more effectively by getting more personnel. I don't want to take a personal care assistant away from a nursing home resident. I want help, and they're incredible, these men and women of the National Guard, to help decontaminate and also mitigate risk. So they can't all just come into a facility. So it's a very thoughtful effort about doing that, evidence-based. It gets reviewed and designed by the medical assistance team, advisory team, and away we go. But that's something we started also in the last day or so.
Thank you, Governor. Next, we're going to go to Megan Abundis with KOB. Megan, you are unmuted. Go ahead and ask your question.
Hi, thank you. My question is about the Army field hospitals. Can you provide us an update on the status of their transportation here, and if you still feel that they are warranted? Thank you.
So this is a hard thing. I hope they're not warranted. The hope should be that we never ever need as much hospital capacity. And I know that seems inconsistent with being, right, the modeling, which I'm going to give a plug to both the team that Dr. Scrace leads and all the men and women at any number of our research institutions, including the University of New Mexico and New Mexico State and Tech and others, and our national labs and a private lab, who all have been engaged in modeling, and now they're getting national attention for this modeling work. All right, so we do follow the model, but the hope is that you're never going to need it. Well, clearly in the Northwest region, we need it, right? So we've got beds and supplies, so we call that's what I call a field hospital or field operation or step-down care site. It gets a number of references, so I wanted to give you all of them. So we've got that in Gallup. It'll be taking patients tomorrow, so yes, it's needed. We are standing one up in Farmington, and we believe, given the number of infection rate increases there and the stresses there, will be needed. We're standing up a similar operation in Shiprock. We have to get healthcare professionals, and we get some from the federal government and IHS, and then we wrap around with other folks in the state. The 200 beds is here in Albuquerque, and we're going to prepare it, get it up, get everything ready. And honestly, I hope I don't need it, right? That's what we want. But if you don't have it ready, and remember, we're moving patients from any other places in the state where they need us, not having it means that we didn't meet our emergency preparedness criteria and effort. And that's why the federal government sent it to New Mexico, because they want us to be prepared. You can't wait till you need it. You have to have it in place beforehand. So we have everything that we've asked for, plus about 50. And I am unabashed about asking for more. I think that we are underrepresented in getting the number of federal ventilators. So I'm going to keep pushing there. And they reduced our priority for those, I think, largely because we flattened the curve. But it's a very precarious week-by-week effort. The Mexicans keep showing the rest of the United States how it's done. But we do have some really tough areas that require our attention. I know I said it last week, and I know Dr. Grace wants to give you some more facts, and I want them. I want every New Mexican to know as much as I know. The whole state is only good if we're covering the whole state. So there's a kind of a notion, well, just put what you need in Gallup and then don't worry about it. No. Or the Northwest region. We will, as a state, support every single New Mexico resident wherever you are. That means having capacity leveraged everywhere. And that's why we have all these resources set aside and ready. So I just want to make sure that everyone knows that we all have an obligation to support our brothers and sisters wherever they might be. Dr. Grace.
Thanks, Governor. I think these alternate care sites also give us a great view into the degree to which our state is able to use data to plan. We saw 4 weeks ago very, very early indications of increasing cases in Farmington and in Gallup. We saw, when we mapped the state, the higher health burden in that area of the state. We saw the lower average income in that area of the state. We saw social determinants of health and other social determinants of health. And we had instinct, and the data was pointing us in the direction that we needed to do something. Took about a week to get those requisitions in. The governor did a great job advocating for those facilities. Started them about 3 weeks ago. The Army Corps of Engineers had them up and built, and now are opening now, about probably a week before we need them the most, which in my opinion, is perfect timing. The other thing to remember about these facilities is they're not intensive care units, they're lower acuity care, and we have a lot of need in this state, and we have a lot of need in Gallup right now for other places for people who can't shelter in place. If we're gonna have a continuous flow of cases in our community over the next year, not everybody can go to their own room and just isolate themselves. We need hotel space, we need some COVID positive facilities for COVID positive people who can't isolate if their families can't move. And so we have in the plan for these 3 or 4 different levels of care. In Albuquerque, for example, we need an expansion of behavioral health services in a facility type setting. And so we're constantly looking at all of those and watching the modeling and watching the case rates and adjusting plans. But we really have 2 or 3 plans for use in every single one of these facilities. And I think the governor's insistence on the use of evidence and data to make these decisions has really served us well to date.
Thank you, Dr. Grace.
Thank you, folks. That is going to be it for today. I'm going to turn it back to the governor to wrap us up.
Right. Again, I really appreciate that so many New Mexicans tune in, that there are so many really important and valuable questions so that we can get information out, that we feel very optimistic about where we are, even with, we're always going to have cases now. It lives among us until there's a vaccine. You know, you create what you hear, this herd immunity. That's how humans need to react to these viruses, but you have to have treatment and a vaccine. We will have to make adjustments as a state and a society and as a family and as workers so that we manage it productively. And I believe that we can. We've demonstrated that we can. But I need folks not to jump the gun. I was in Albuquerque on Wednesday, socially distanced, wearing a mask, staying in my vehicle for a very specific purpose. I had 2 actually. It was my son-in-law's 42nd birthday. I drove by his house and I threw a birthday present out the window of the car. And I got to wave to my grandchildren. I also went to go see my mother, who's in a long-term care facility, an assisted living facility, and my fiance, the first Manny Cordova, his mother lives at the same place. So with masks and gloves, through a window, I went to say hello. And then I came home. I don't go anywhere else. I follow as strictly as I expect you to follow the very same stay-at-home instructions. And I rarely am out and about. The highway was jam-packed. People were moving all over Albuquerque. There were lines of cars and people out. And we got complaints about businesses being open. I need everyone, no matter how optimistic we are, and how hopeful we are, and that the evidence demonstrates that we're having an impact. It's too early not to stay the course. We will ease. We believe we can. That's the only reason I'm doing it. I believe that we have the opportunity to do public health work, to save lives, and to address economic concerns. They're real. But as important as that, people want to get out and people want to go back to work. We want that to happen too. So we need to balance that, and we're in a position. You don't get to hold that position for very long if people just determine that the worst is over and now we can behave differently. The worst is not over. We cannot really behave differently until there's a vaccine. New Mexico, let's stay in this together. I know that we can. I need your help. Stay the course. Don't jump the gun. We're in it together. We can make a difference together. Thank you very much for tuning in.